ADD, ADHD, PDD-NOS, autism, and Asperger's are all treatable, and in many cases we've seen these kids recover. Now that might be a hard thing for you to swallow, I guess, but what you need to know is the brain is capable of doing some really incredible things if you give it the right fuel and activation, which is what our program is about. It's a neurologically based approach to autism, Asperger's, and all these other conditions. And what makes it different is most people look at these things as behavioral problems or at best a psychiatric problem, when really in fact it's a neurological problem involving the different areas of the brain, including the frontal lobe, the thalamus, the cerebellum, maybe the basal ganglia. So we treat it as that, a neurological problem. And it's the neurological problem that causes these behavior problems, the symptoms. So if your child has these symptoms or has been diagnosed, it's never too late to change what's happening. When we describe a child like this, you're describing a child whose brain is out of balance. It's not in sync with itself. So the bottom line is this: the brain gets out of sync and one side can become very dominant. And about 99% of the time with these spectrum of problems, the left brain becomes very dominant like a bully, and the right side of the brain becomes very neglected. So we can get an accentuation of left brain function and a decrease in right brain function, which is why you see a kid that fits these types of profiles. Now, unless corrected, that neglect almost always stays the same, and this discrepancy between the two sides almost never corrects fully. So our program of functional neurological exercises addresses these imbalances and weaknesses, but we don't just stop there. We also want to look at food allergies and food sensitivities, nutritional deficiencies, possibly autoimmune problems. And this discrepancy between the two sides almost never corrects fully. So our program of functional neurological exercises addresses these imbalances and weaknesses, but we don't just stop there. We also want to look at food allergies and food sensitivities, nutritional deficiencies, possibly autoimmune problems, hormones, blood sugar regulation, anemias, and we want to look at all these things all at once so that no stone is left unturned to find out exactly what is causing your child to have these problems. To learn more about our comprehensive approach, please fill out the box below or call our office at 814-238-0232 to receive a complimentary information packet.